Welcome to the deep dive. Okay, today we're tackling something that causes a lot of worry for new parents, but it's usually totally harmless. We're talking about baby acne, those little red or white bumps that pop up on your newborn's perfect skin, and you immediately think, oh no, what's this? Are they having teenage problems already? It's a really common stressor. So you gave us some great sources looking into the symptoms, the causes, which are pretty interesting, and how to handle it. Our goal here is simple. Give you the clear facts fast. We want you to know what those little spots mean and maybe more importantly what they don't mean, and when you can just relax.
Exactly. And relaxation is really the goal here. What the sources show is that this condition, neonatal acne, it's common, it's generally mild, and it goes away on its own. Transient is the word. Honestly, the parental stress seems like the biggest side effect. So, yeah, we'll focus on the key signs like when it appears, where it appears, what it looks like, so you can tell it apart from anything, more serious.
Right, that's the crucial part, isn't it? Knowing the difference between this is normal and, maybe call the doctor. So, okay, let's dive in. What exactly is baby acne, and how many babies actually get it?
Well, the sources define it pretty clearly. It's called neonatal acne, technically, and it looks like small red or sometimes white-headed pimples, usually on the face, think cheeks, nose, forehead, though occasionally you might see it on the chin or even a bit on the upper back.
Okay, cheeks, nose, forehead. And you said common. Like, how common are we talking? Because I imagine when it's your baby, it feels pretty unique and maybe a bit alarming.
Oh, absolutely. It always feels different when it's yours, but the numbers. Around 20% of babies get it each year. So yeah, 1 in 5 newborns, that's pretty common. And the timing is really key here. It usually shows up within the first 2 to 4 weeks after birth.
2 to 4 weeks. Okay.
Yeah, not usually right away, but in that first month, that's the peak window.
That time frame, 2 to 4 weeks, that's a really important marker. Do the sources mention anything about boys versus girls? Is one more likely to get it?
They do mention that, yeah. And it's interesting because it kind of hints at the cause. Boys seem to get it slightly more often than girls.
Huh. Slightly more boys. Okay.
It's not a huge difference, but it's noted. And like I said, it probably links back to the hormonal reasons we'll get into.
Fascinating. Okay, so we've got the when and the how many. Let's talk visuals.
Yeah.
What do these bumps actually look like? Are they just tiny zits like adults get?
They look like clusters of small blemishes. You might see little red bumps, those are called papules, or maybe bumps with a little white head, which are pustules. Often the skin around them is a little bit red too. But here's a really, really important difference you need to remember. Unlike acne in teens or adults, baby acne does not have blackheads.
No blackheads.
No blackheads, what doctors call open comedones. And it also doesn't have those deep, painful cysts. It's much more superficial.
Okay, wait, can you explain that a bit more? What's a comedone, and why is it such a big deal that baby acne doesn't have them?
Right. So a comedone is basically just a clogged pore. A blackhead is a comedone that's open to the air, so the gunk inside oxidizes and turns black. Whiteheads are closed comedones. The fact that neonatal acne doesn't usually have blackheads or those deeper cysts tells us it's not the same process as teenage acne. It's simpler, more superficial, caused by that temporary oil surge, not, deeper inflammation or bacteria in the same way. It's a key visual clue.
Got it. No blackheads, no deep cysts. That's a clear visual marker.
Yeah.
The sources also mentioned flare-ups, right? Like if the baby cries or gets hot, it looks worse.
Exactly. That's a common observation. Anything that increases blood flow to the baby's skin temporarily, like crying, overheating, maybe even rubbing against rough fabric, it can make the existing redness and bumps look more obvious for a little while. It doesn't mean the acne itself is getting worse. It just means you're seeing it more vividly because of that flush.
Okay, that makes sense.
Yeah.
So we know what it looks like when it shows up. Now the big question, why? Why does this happen? What's going on with my tiny, perfect newborn?
Okay, so the why. The most likely reason, based on what we know, is hormones. Specifically, maternal hormones.
Maternal hormones, you mean from the mother?
Yeah. During the later stages of pregnancy, hormones from the mother, particularly androgens, cross the placenta into the baby's system. And these hormones kind of hang around in the baby's body for a bit after birth. These leftover hormones then give the baby's own oil glands, the sebaceous glands, a little kickstart, maybe too much of a kickstart.
So it's like a hormonal handover effect from pregnancy. The baby's body isn't making these hormones surge. It's just dealing with the mom's leftover ones.
That's a great way to put it. It's the residue, the lingering influence being processed out. And you combine that with the fact that a newborn's oil glands are still pretty immature, still figuring things out. So they get this hormonal signal, they overproduce oil temporarily, the pores get clogged, and boom, baby acne. It's part of adjusting to life outside the womb.
And does that connect back to the slightly higher rate in boys, the androgen link?
It seems to, yeah. Androgens are often thought of as male hormones, though everyone has them. But perhaps in baby boys, that extra signal from the maternal androgens has a slightly more pronounced effect on those developing glands. Or maybe they just clear those hormones a tiny bit slower if it's the picture.
That actually makes a lot of sense. It takes away some of the mystery, you know? Okay, let's tackle the guilt factor. Because parents worry. They think, is it something I did, something I'm feeding them, something in the house? What about family history? If I had bad acne, is my baby doomed?
Right, let's bust some myths. First one, family history. Nope. Your teenage breakouts have nothing to do with your newborn's temporary bumps. Genetics might play a role in acne later in life, absolutely. But this neonatal acne, purely about those temporary post-birth hormones, it's biological adjustment, not inherited destiny. So you can let go of that worry.
Okay, huge relief for many parents right there. What about breastfeeding? That's another common concern. Is something in my milk causing this?
Another big source of unnecessary guilt. No, breastfeeding does not cause baby acne. Remember, the hormonal trigger starts in the womb way before the first feed. If parents notice it seems worse after feeding, it's far more likely to be simple irritation, maybe a little milk residue left on sensitive skin, or just the warmth and friction of being held close. It's contact, not the milk itself causing the acne.
Okay, not the milk. Good. And the last one, the kisses. Grandma comes over, smothers the baby in kisses. Are those loving pecks the culprit?
No, kisses aren't the root cause either. Again, the acne is driven by those internal hormones. Now, could excessive slobber or maybe grandma's perfumed face cream cause some temporary surface irritation or redness? Sure, but it's not causing the acne itself, just maybe making the existing spots look a bit redder for a moment. The bottom line here is, you didn't cause this, you can't really prevent it, it's a normal phase.
Knowing it's temporary and not your fault is, I think, incredibly helpful. So if we can't prevent it, the next job is telling it apart from things that do need attention. This is where we need that clear distinction.
Yes, absolutely critical. The main thing to distinguish neonatal acne from is something called infantile acne. They sound similar, but they're quite different.
Okay, neonatal versus infantile. Break that down for us again, especially the timing.
Right, neonatal acne, that's the one we've been mostly talking about. Starts age 2 to 4 weeks, looks like small, simple bumps, papules, pustules, no blackheads, no cysts. And crucially, it goes away by itself, usually by 3-4 months old. No scarring risk. Infantile acne. This one starts later, typically between 3 months and maybe up to a year old. And this one looks much more like teenage acne. It can have blackheads, whiteheads, deeper inflamed bumps, and sometimes even cysts or nodules.
Ah, okay, so the age of onset is a huge clue. If you see those blackheads or deeper spots appearing after 3 months or so, that's the flag.
That's the big red flag. Later onset, plus those more complex lesions, blackheads, cysts, that suggests infantile acne. And that version can last much longer, potentially years, and it can cause scarring if it's not treated. So infantile acne definitely needs a doctor's attention.
That distinction is super important. Okay, what about other common baby skin things like rashes? They can look kind of similar from afar.
Yeah.
How do we tell baby acne apart from, say, eczema or heat rash?
Good question. There are a few key differences. First, appearance. Baby acne, those little pimples, may be a bit red. Eczema, usually dry, red, scaly patches, looks really irritated. Heat rash, often tiny, clear or red blisters, looks prickly.
Okay, appearance. What about where it shows up? Location.
Location is another big clue. Baby acne is mostly face, cheeks, forehead, nose. Diaper rash, obviously confined to the diaper area. Heat rash loves folds, neck creases, armpits, groin. Eczema can be on the face, but often also shows up on elbows, behind the knees.
Got it. Location. And maybe the most important difference.
Symptoms, or rather the lack of them for baby acne. It doesn't bother the baby. It's not itchy, not painful. They don't even know it's there. Whereas eczema is typically very itchy. Babies will rub and scratch. Heat rash can be prickly and uncomfortable. Other rashes might cause fussiness. If the baby seems totally unbothered by the spots on their face, that points strongly towards simple baby acne.
That's a fantastic practical tip, the itch factor. Okay, let's quickly revisit scarring. You said neonatal acne doesn't scar, but parents might be tempted to,
Well,
squeeze them.
right. The risk of scarring from true neonatal acne itself is virtually zero because it's so superficial. It doesn't damage the deeper skin layers. But IDT, and this is a big, but you absolutely must resist the urge to squeeze, pick, or scrub them. Doing that can cause irritation, introduce bacteria leading to a secondary infection, and that could potentially leave a temporary mark or discoloration. So rule number 1, hands off. Leave them alone.
Hands off. Got it. Which leads us perfectly into managing this.
Yeah.
If it's usually harmless and goes away on its own, what's the recommended approach? Is there even a treatment?
The best treatment is often, well, doing very little. The consensus is definitely less is more. Gentle skincare and avoiding irritation is key.
Okay, define gentle skincare for a newborn's face.
Super simple. Just wash the baby's face once a day. Use plain warm water or maybe a tiny bit of a very mild, soap-free, fragrance-free baby cleanser. And the drying part is important too. Gently pat the skin dry with a soft towel. No rubbing or scrubbing, just pat, pat, pat.
Pat, don't rub.
Okay.
And what about applying stuff? Should parents reach for adult acne creams? Maybe try to dry the spots out?
Absolutely not. That's a definite no-no. Never use acne products meant for teens or adults, things with benzoyl peroxide, salicylic acid, retinoids. They're way too harsh for a baby's delicate skin barrier and will cause serious irritation, maybe even burns. And also, because the issue stems from overactive oil glands, you generally want to avoid slathering on thick, heavy creams or lotions on the affected areas. That could potentially clog pores even more. Light, non-comedogenic moisturizer if the skin seems dry elsewhere, but avoid putting heavy stuff right on the acne.
Okay, no harsh chemicals, avoid heavy creams. What about home remedies? I saw some mentions. Are we talking old wives' tales here, or is there anything safe you can try?
Well, there's one that pops up in sources that sounds a bit like an old wives' tale, but has some logic. Applying a little bit of breast milk.
Breast milk.
Really? Yeah. Applied topically, like with a clean cotton ball. Breast milk does contain antibodies and some anti-inflammatory components. It's not going to cure it, but it might offer some gentle soothing for minor irritations. Natural and generally harmless to try. Other than that, maybe a very light hypoallergenic natural balm with some calming like calendula or chamomile if the surrounding skin seems a bit red or irritated. But generally, just keeping it clean and dry is the main goal.
Wow, okay. Breast milk. Interesting. So mostly it's about gentle washing, patting dry, hands off, and patience.
Patience is probably the main ingredient, yes.
But there must be times when patience runs out or something changes. We need the clear red flags. When should parents stop waiting and call the pediatrician?
Definitely. There are clear signs when you need to get it checked out. First, if it just doesn't go away. If the acne lasts longer than, say, 3 or 4 months, and especially if it's still there past 6 months, neonatal acne should be gone by then. Persistence is a flag. Second, if it seems to be getting worse instead of better over time despite gentle care, or if the pimples start looking different, becoming really large, very inflamed, painful looking, or showing obvious signs of infection like lots of pus, crusting, or spreading redness and warmth.
Okay, persistence, worsening, signs of infection. What about those specific types of spots we talked about?
Yes, exactly. If you start seeing true blackheads or those deep, hard, cyst-like bumps develop, especially after that initial newborn period, that's a major sign it might be infantile acne, and you need that medical evaluation.
And location too, right? If it spreads off the face.
Correct. If the acne starts spreading significantly down the neck, onto the chest, back, or limbs, that's unusual for simple neonatal acne and suggests something else might be going on, maybe a different kind of rash or condition. So basically, if it lingers too long, gets worse, looks infected, develops blackhead cysts, or spreads widely, time to call the doctor. Or even just if you're worried after several weeks and simple care isn't helping, it's always okay to get it checked for peace of mind.
That's a really clear checklist. Thank you.
So just to wrap up the core message from our deep dive today, baby acne, the neonatal kind, is overwhelmingly a normal, temporary thing. It's caused by those leftover maternal hormones. The best approach: gentle washing, avoid irritating it, and just wait it out. It almost always clears up beautifully on its own without leaving a trace.
That is so much clearer now. It really takes the fear factor down quite a bit, knowing what it is, why it happens, and crucially, what it isn't. Thank you for walking us through the sources and giving us that confidence. Hopefully you listening feel a lot more reassured about those little spots now.
Absolutely. And maybe a final little thought to leave you with: Considering that this very common, very visible condition is directly caused by the mother's hormones lingering in the baby, does it maybe offer us a tiny visible peek to how powerfully connected the mother and baby still are biochemically, even after birth, and how those hormones might be subtly influencing other developing systems we can't see? It's a fascinating echo of that deep biological bond, something to think about while you're gently patting those little cheeks dry.